Hi, and welcome back to Anchor. Now, today we're going to be focusing on euthanasia, so a nice happy topic for everybody. So you'll mostly be hearing from Mum. Now, we will be focusing on attempts on Patrick's life in hospital. But as I said in the last video, I will be giving you an update on Patrick's current situation. So there is no update regarding the OPA. We have still not heard from them, have we? Despite my lovely email that I sent them.
Yes.
Charming as always.
Actually, I'm going to write to the magistrate person who ordered
the senior magistrate at VCAT that overruled the other lady.
Yeah.
Yep. We'll go into that because that's a style, a part of euthanasia, I guess. Yes. VCAT style. So the only update that we actually have is the fires. So Patrick resides in the Ballarati area, so not Ballarat, but that area, and there's been fires surrounding that area, as I'm sure everybody in Australia knows. We are concerned about the air quality because Patrick's got breathing difficulties, and we are concerned that he has been evacuated, not the evacuation part, but the part of where he's been evacuated to. We have zero information. So Patrick's mother...
It's a very stressful time for us.
Patrick's mother's looked after him. Pretty much he's lived on you, hasn't he? For 35 years.
He's literally been attached to me.
So it feels like she's lost a limb. Completely ignoring the fact that his mother has no information on where he is or how he is. Okay, now, again, Rupert says hello. Biggle says hello, and Bertie is in the background, so I'm sure he'll make an appearance.
Yes.
Okay, so over to you, Mum.
Well, we're not talking about voluntary euthanasia, we're talking about involuntary euthanasia, passive and active. No Zyklon B, fortunately, but just
no
as
what?
bad. Explain later.
Okay.
Children these days, so we mean. Yes, well, there's two types of involuntary euthanasia, passive or active. Passive is when, as I described before, you would abandon your child in a room without care, or, in the past you might have put it on the hillside for the wolves. Both the same outcome, and probably...
I'd prefer the wolves.
The wolves are probably kinder.
Bit faster.
Yeah.
I think some last for up to 3 months.
But we're also going to be mentioning attempts at active euthanasia on Patrick. He's had a couple of attempts like that. Well, attempts we know of. We're not medical people. It's only good luck that we know about some of them. Okay, well, Patrick developed pneumonia when he was 14 months old. I took him up to the GP and he said, you can take him to hospital or you can keep him at home. And I said, well, does he need to go to hospital? And he said, well, it's up to you. He said, it just depends whether you can cope with him dying at home. Okay, can't cope with him dying anywhere, we're going into the hospital. So we left the little guys behind, and my husband and I raced Patrick into the hospital. And we were about an hour away, and there was massive traffic. It was a bad time of the day to be taking someone in an emergency trip, and we were both really upset and crying and stuff, and we staggered into the hospital. The nurse was fantastic. She immediately said, don't cry, it's not a panic, there's nothing to worry about. She said, watch this, it's magic. And she put an oxygen mask on Patrick's face, and with instant recovery. He just looks not having any trouble at all. His colour came up and he looked really good. And then the resident came in and had a look at Patrick. He put him on his knee and he picked up a bell and started ringing it on either side of Patrick really, really quickly. Didn't give him time to react. He had a blue ball and he went like that. And Patrick, of course, did not track that ball. Even though we were so upset, I thought, I see the funny side. I thought this was funny, and I whispered to my husband, I think he's going to tell us he's disabled. So then he turned round to us with a big smile on his face and he said, this is the best thing that could ever happen. Just leave him here and we'll call you when it's all over. total shock. And I said, well, would you like to repeat that to the police and the press and our solicitor? And he got all flustered and left Patrick and disappeared. Then the paediatrician that Patrick had seen occasionally, a Spastic Society paediatrician, came in and she said, oh, we're really, really sorry. This is, he's a young guy, he's just training, he doesn't know anything, it's fine. So we got some medication, we took Patrick home and he was fine the next day, so no worries. And then Patrick enjoyed really good health. Until he was about 13, and then he started having seizures, and these were a different type of seizure. Remember, Patrick doesn't have epilepsy. We have never had any explanation for these seizures. Neurologists and doctors who see it, and they always say, oh yes, that's epilepsy, and off we go for more tests. No. The only suggestion we've had is spastic spasms, but and by the way, spastic's not an insult, it's a medical diagnosis. So he was in and out of hospital a lot over, the next, until he was 20.
Well, that's why I know so much about doctors and hospitals, because I used to live in there with them.
Yes, well, we never leave Patrick alone in hospital.
You can't leave anybody in hospital alone, even the ones who can communicate.
No.
Hospitals are filled with psychopaths.
Well, you'd have to be suffering unbearably, and you'd have to convince me that you were suffering unbearably.
And from what you said, don't worry, I know you're not going to do anything here now. I'm not scared. Yeah, I'm not scared.
I know. Perhaps we shouldn't say that. There's some really good people who are doctors.
Yeah,
but I remember on one occasion, Patrick was in intensive care. They were mainly babies and tiny children. He was in a room, I think there was 4 or 6 beds. I can't remember now. We were the only parents there.
How old is he? Yeah.
How old is he?
Yeah.
I don't know, because he went to hospital so often. He would have been
Approximately?
probably about 15.
Thank you.
Yes. And he's we were the only parents in the room. And I said to my husband, because he was insisting that I go home because I'd been there for ages and he'd been in and out. So he said, well, I'll do the night. I don't know whether I trust you. You go to sleep.
Dad,
Yeah.
he does go to sleep.
I was particularly concerned about the drip in Patrick's hand, and I said to him, you have to stay awake and you have to look at his hand.
Oh, I know this one.
Yeah, if it starts to tissue, you better call someone to fix it. Patrick has a habit of this. His hand will swell up and go blue. I don't know whether you'd lose your hand.
The needle slips out of the vein, and then it just pumps the liquid into the hand, basically.
Yes. There's so many occasions I can't actually remember exact days of each incident. I do have records, but a lot of them were stolen.
It all kind of blurs into one horrible...
Yeah, it's just one horrible nightmare. We don't know what these fits are, but what he does is jerks forward and vomits, and the vomit doesn't come out his mouth, it comes out his nose and goes directly into his stomach.
If you're lucky, it comes out the nose. Sometimes it just doesn't make an appearance and goes straight down.
Straight down to the lungs. That causes
aspiration pneumonia.
I know, but it's my turn. Okay. So my husband's going to stay there so that I can have a break, because I've been awake for days. I can't remember the last time I slept at that time, or how long I've been awake. So I went home, and my husband, of course, went to sleep. When I came in the morning, Patrick looked fine, and he's there. He's got a what do you call it? B-pack or BiPAC or something on his face.
The one that pushes.
Yeah, it's a respirator.
Yeah.
But he's looking okay apart from that. Obviously, we have a very low bar of what we call okay. I looked at Patrick's hand. No, it's not tissuing. And I said to my husband, how'd you go overnight? And he said, he was fine. A nurse came in about 11 o'clock and changed the IV drip. And we all got told to go out. There was one other mother who'd just arrived, and she was saying to us, because it's a nurse's handover, so that's why we had to go out. And she said to us, "What's going on?" She said, "Parents have never been asked to leave before. Why are we being asked to leave now?" And, we thought, well, it's obviously to do with us.
Yeah.
It's always us. And so when we were back in, then I discovered what was wrong. Although I checked Patrick's hand, I hadn't checked the status of the IV infusion, and the cable was pulled out. So Patrick would be dehydrated and was laying on the floor behind the bed. So it looked like he was getting it if you didn't have time to have a really good check around, or if you were just making a brief visit. So we're sitting there and ask the nurses, "Can you reattach it?" "I don't want to reattach it, but it's been laying in dust, it needs cleaning up and we need a new one." Well, the nurse disappeared, and in comes a German doctor, and he starts to say, scream, literally. He's on one side of the bed and I'm on the other, and he's just screaming at me, "You're a terrible mother. How can you let your child suffer like this?" And he's refusing to put the thing back. He said, you have to let your son die. It's just cruel. It's going on like this for hours. And my husband was striking down. He was just standing there. He doesn't know what to do.
This isn't an evil person, by the way. It's
No,
somebody
this
whose
is someone
actual
who
belief
has-
system is this.
Yeah, actually, he convinced me that he's genuine. He really feels that
Patrick's suffering.
Yeah, the Patrick's suffering. He's not he's a useless eater or life unworthy of life or something like that. He just actually wants to help. But it took me a while to think about it afterwards. At the time, I just said to him, that he was a sad loss to the Third Reich. And he stopped off. First he put the drip back. He picked up this drip out of the dust that's all over the corners of the...
And put it back in?
And stuck it back in.
Lovely.
Okay, well, let's hope we don't die of infection instead of dehydration. And that was a really traumatic attempt. Patrick was going to a different hospital than the one of the last incident, and he, every time I'd walk in the door, I'm used to it now. Every time I go to hospital, I'm asked if I'll agree to allow him to die. And I always just say no, and they're happy with that. Nurses walk away quite happily. But on this occasion, Patrick was admitted with only a 2-day break. And same nurse, same question. I said, "You only asked me that 2 days ago. Do you think I've changed my mind in 2 days?" And she said, "Oh, it's hospital policy. We have to ask." Hospital policy. It should be hospital policy to keep your patients alive. Not dispose of them. Then numerous other incidences like that. So we decided to go to the private hospital. Patrick's always had health insurance. It's one of our big expenses. I mean, before his abduction.
We don't know if he still has health insurance now. do we?
No, we don't know. It was costing me $2,000 a month just for health insurance, oxygen, continence products and medication.
It's able to not cheap.
Yeah, it's not a cheap thing to be.
Okay, so we're going to be talking about incidents now when Patrick's actually an adult, not a child anymore.
Yeah,
That's why the hospital changes.
yeah. Okay, well, Patrick was an adult now. He'd been going to adult public hospital, see the experts. But we decided to go to a private hospital. Now, Patrick actually started his life in that hospital, so we had fairly kind feelings about it.
This is the Petri dish.
Yeah.
Yeah.
Okay, so then we're in there, always asked if we'll get rid of him. But by this stage, we've had so much experience with hospitals and things that we know there has to be someone there all the time. You need to make it obvious that you're taking notes. Don't give all the personal care needs to be done by the family. The less contact with staff, the better.
Make sure DNA is not signed because that's treatment as
never
well.
sign a DNA.
You won't get antibiotics, you won't get a drip. It's not just no resuscitation.
It's not just, we imagine a DNR is
do not resuscitate.
People electrocuting you. And,
it's do not treat.
Yes, it's do not treat.
Should be DNT.
Yeah, it should be, but no one would sign it then. Unless they
Yes.
wanted to throw off their mortal coil. And medication. Make sure that you never, nurses give medication and make sure it comes from the pharmacy in a sealed box and you give it. And these days you can Google it and see what it actually is because it might not be what you think it is. The problem is the drip. And on this occasion, Patrick had a little bag of potassium attached to the drip. Okay, he's had potassium before, fine. And then two nurses came in, one and a little helper. And the nurse changed that because it was empty and put another bag up. And I should have been alerted because the other nurse tried to stop her and said, but no, she told her shh and walked out. So now I'm very suspicious about this potassium drip, but I don't know anything about it. And when we took Patrick home, he had a resting heart rate of 160 for 3 months. And the doctor was very surprised to see him again a few years later. He said, "Oh, I thought he must have died." Well, you'd think he would have, wouldn't you? I think most people would with an overdose of potassium.
In defence of doctors, they only see him when he's really sick.
They do. They only see him when he's really ill. I know Patrick's respiratory specialist. We took Patrick when the fits started up again after he has
periods where
he has periods of remission, and Patrick's trying to explain to him in Patrick language that he's better do something because this is not good, and he's smiling, and the doctor said, "Oh, he can smile." I said, "He smiles all the time." He laughs and tells jokes, you only see him when he's sick. But on this trip, this started badly. Actually, this was really horrible. Whole family was taken into a little room, and there were various medical staff in there, and they're telling us that Patrick's going to die, that he's got one lung that's totally collapsed. It's a complete whiteout on the X-ray, no chance of it reinflating, can't be reinflated because he wouldn't survive whatever the process is to reinflate a lung. And so...
This was the visit where we were both sitting across from each other waiting for him to take his last breath. I remember this.
Yeah, and people were crying, and I just got the shakes and couldn't stop shaking. It was... I just couldn't believe this. I just felt absolutely terrible and guilty. It was awful. Patrick's lung may or may not have been collapsed. When he came home, this is after the potassium, when he's got the potassium, his breathing was fine. And from what I could see, both lungs were inflating evenly and normally.
This is when we were saying Pat got rid of his pesky lung. Yeah. Much better without it.
Yeah. But after about 6 weeks, we thought, this is ridiculous. Obviously his lungs not collapsed. So we went back in for another X-ray. We had another X-ray, very sad, it's collapsed, totally collapsed, hasn't recovered. It was really funny because on the next visit, they X-rayed his lungs again. And the doctor came in and he said, "Oh, I've got some really bad news." And I said, "Oh, yeah, I know." And he said, "There's a small collapse on one side."
He obviously hadn't been given the briefing for...
No. And I said, "What, you mean both lungs are okay?" And he said, "Oh, yeah, it's..." and he showed me the X-ray, it's a little tiny bit. It's typical, but you just cause so much distress you know, in the medical profession when they do this. You know, hearts racing, people sobbing, trying to console children.
They're called ghouls.
Yeah.
They get off on it.
Yeah.
You'll see a sparkle in their eye when they talk about the dying. You're very close to death now. And there'll be a twinkle.
Yes. Well, that was my husband later when I nursed him. He died of pancreatic cancer and he died at home in palliative care, but I still couldn't protect him. But we'll might talk about that another time. I don't want to get into euthanasia of other people. I'm only thinking of euthanasia of my child. We kept going to hospital. People kept asking, you know, will you leave him to die? Sorry, no, not today. And
Maybe tomorrow.
Yeah, no, never. Oh, I should talk about the previous one where the German doctor was yelling at us. They think nothing of speaking about this in front of Patrick, who understands English perfectly.
Yeah, never good. You can see a little terrified eyes.
Yeah. And this time he's looking absolutely petrified. He's got the thing on his face, he can't say anything.
Can you imagine being absolutely helpless? And
Yeah,
somebody's
absolutely
sitting there?
helpless, and someone's standing over you, screaming that you should die. But anyway, okay, how do I explain this so it sounds good from Patrick's point of view? So I said, well, you know, poor man, he has to come in here every single day and look after people like you. If he doesn't, he'll have no dinner. He won't be able to go to McDonald's, nothing. Patrick's got normal intelligence, but his life experience is zero. So these sort of explanations work. So Patrick's very sympathetic to the doctor now, you know, poor man.
Poor man.
Yes.
Life's hard.
Yeah, he was just having a, you know...
Bad day.
A bad day. So we kept taking Patrick into hospital, and very straight, you know, I mean, there were lots of other incidences that I can go into, but I won't. I'll just stick to the highlights. But Patrick's respiratory therapist is suddenly starting to say things like, who's Patrick's guardian? Well, Patrick doesn't have a guardian. I mean, Patrick signs legal documents. He's a person. He signs in front of notaries and, you know, things like that. He can communicate. But, you know, for some, you know, they think of my son as some sort of unworthy of them. And he was getting really persistent about this, and I'm explaining to him that Patrick's just a normal person. If we voted, you know, and he wanted to vote, he could go and vote. He's just got the same rights as everybody else. He doesn't need a guardian. He certainly does now. I underestimated his need for guardian, trusting soul that I am. I think that was the start of what's happened now. Patrick didn't go to hospital then, 3 years before his abduction. He was perfectly healthy. He'd stopped doing the whatever those fits are.
Although his current carer tries to take the praise for
Him
Patrick's current condition.
And actually boasts about not taking him to hospital now when he's seriously ill, but it would be far too dangerous to take him now.
We don't know if a DNA has been signed.
Patrick's respiratory therapist, once when my son was just about to go home, he was there with me in the hospital with Pat, and you know, the doctor said, can you come out in the hall? And I thought, oh great, but at least he's got the taste not to talk about it in front of Patrick. But what he wanted to tell me was to warn me that there was a DNR signed in Patrick's notes. I would never have thought that one of my children would have signed a DNR.
We don't know this for 100%,
No,
but the
we
only
don't.
person in the room was his brother, and the doctors never take mum out of the room because they don't have consideration for Pat, so it's very strange.
Yeah, it was very strange.
And the actions of the treatment of Patrick currently is very indicative of palliative care.
Yes, but I just wanted to get back to Patrick. I said, look, nobody signed it. It's fake. Get rid of it. And he didn't say any more about it. So I figure he's done his duty. He's warned me. And then Patrick didn't go to hospital again for 3 years. And he's, you know, he's in remission again. He often had, you know, a year or 2 or 3, 3 years actually, between 20 and 23 was the longest he's ever had before without doing this. So I really didn't think that maybe this was a done deal and he was going to give up doing this little thing. But so we stayed in the city, so we'd be close to ambulances and hospitals and things like that. One of the most distressing incidences, and one that still gives me nightmares, was we'd gone off for x-rays for Patrick. When we came back to the room, Patrick's got oxygen in his nose, and the nurse said, oh, he's fine, he's on 98. Well, 98 with oxygen, and the condition he was in was good. He was quite ill, had aspiration pneumonia. And when we got back to the room, the monitor was turned off and she told us it was broken. So he's not being monitored at all.
Get a new one.
No, it's just unplugged, it's not broken. We stepped that later. But Patrick got on the bed and they transferred him to his bed, and Patrick starts to panic, and he's gasping and yelling at me and feisty and fury, and Patrick does get a bit panic stricken when he can't breathe. And I'm saying to him, look, you're fine, nothing's
It was an overreaction, really.
Yes, you know you're always fine, just calm down. So I'm trying to calm him down and being reasonably firm, because it's the best tack to take with Patrick when he panics. And then I noticed that his lips were turning blue, and his face had a bluish tinge. And we'd brought the monitor with us, so Patrick's brought a monitor. So I said, plug it in quickly. So we plugged it in, and Patrick's oxygen was 84. And okay, now check the oxygen. No oxygen's coming through. We look at the oxygen from the wall, it's not turned on. So I race to turn it on and get past her, past the nurse who's standing there, probably just waiting to declare dead or something. And she'd watched the whole thing. She was quite happy to stand there and watch Patrick panicking. And she tried to stand my way. So before I tried to push past her, but my son leaned in behind the bed and turned it on. And Patrick immediately calmed down. Oxygen went up, he was fine. And I said to her, this is a perfectly respectable looking young girl. And I said to her, why did you try to kill my son? And she said, doctor, I know his name, but I won't say it. I'll never forget. Told me to do it. And I was pretty ticked off. Read her the riot act, and she disappeared. She came back with another doctor later. We told him what had happened, and he asked her what's going on, and she explained to him that Dr. Thing had told her to do what she did, and but it's just beyond belief. Imagine being at that age and having somebody's murder on your conscience. It's awful to think of, just from her point of view.
So we're going to be scooting ahead to what's happening with Patrick again right now. His oxygen average used to be always between 96 to 98, yes. More to the 98 end, without oxygen assistance. His oxygen level since 2024 is between low 80s up to 86, occasionally up to 91, 92. So that's the oxygen saturation. He needs 24/7 oxygen assistance now, or he loses consciousness fairly quickly. Now, the respiratory specialist that Patrick's had for many years has seen Patrick 3 times in these 5 years.
Well, he says he has, so this could have easily been phone conversations.
There could have been Zoom appointments, could have been anything, so we're not sure. Nothing's been confirmed. But in the report, it does state that his oxygen average is 92% without oxygen assistance, and that is perfectly reasonable considering Patrick's condition. There's no explanation of Patrick's condition where he's just saying that because he's a quadriplegic, that 92% is fine.
92% is not conducive to long-term survival, and certainly if you're down in the 80s, you're dying.
Hi, so just to interrupt very quickly, I did want to show you guys the report from Patrick's respiratory specialist. Now, this is written on the 20th of the 1st, 2025. This is Patrick's doctor of 19 years. So just draw your attention to the line starting with problems. It states that Patrick has epilepsy, a collapsed left lung, and asthma. Patrick does not have epilepsy. Patrick does not have asthma. Patrick, prior to his abduction, did not have a collapsed left lung. Now, he also refers to Patrick's oxygen saturation, which is 92% on room air. He states that this is considered good and satisfactory for someone with his underlying respiratory disease. Patrick doesn't have respiratory disease, and that's the only explanation that he's offered. He has ordered no investigation, no x-rays, nothing at all. Now, the long-term effects of an oxygen saturation of 92%, cardiovascular strain, cognitive and neurological issues, respiratory system complications, organ damage, and increased mortality rates. Now, if it drops below 88%, which it does on a regular basis, and we find him like that when we first visit, we often see him at 82 up to 86, just left without oxygen assistance. Now, 88% it requires immediate emergency care. Although in Patrick's case, no explanation offered, 92% is perfectly okay. Correct. But the OPA, who were hoping to have a guardian appointed before Christmas, is now refusing all contact with myself and my mother. They will not give us any update on the status of the guardian, and I was hung up on yesterday and told that the manager would call back. This has not occurred. Now, let us know in the comments if you agree or not, but something as life-threatening as this to Patrick, just being accepted as being perfectly okay, is very indicative of palliative care in our eyes. So why is there no investigation into what has happened to Patrick?
And we keep inquiring, saying, you know, what happened to Patrick? Nobody will tell us what happened.
Reported...
It was very sudden. We saw him at Christmas because he, as would be alone on Christmas Day with just my daughter. Everybody goes off to their various spouses' families for Christmas, and Christmas is a big deal for Patrick, so we go up to keep him company, do the best we can. And we had a really bad car accident, stuck in an oil slick, and we were fortunate. We had to have our car tidied up so that it was drivable, and we didn't get back for 4 weeks. We're only allowed to see him every 2 weeks. Every 2 weeks, and we have him for 2 full days. And
again, since November last year, since December last year, we haven't seen him though.
We haven't seen him, no.
So yeah, there's you need to ask why is Patrick's current carers not supplying, not investigating what has happened, and why is an oxygen percentage that's not conducive with long-term life perfectly okay? That's why we are saying that it appears to be palliative care. We do have other reasons as well. He has engorged veins on his abdomen. Look, I'm not a doctor. I'm not saying that there's something seriously wrong, but that is a serious symptom that does need to be investigated. Patrick and I both have stomachs that bleed. Engorged veins on the abdomen can be a sign of internal bleeding in the abdomen. So, last time we saw him, he had pressure sores. This was over a month period, so originally they hadn't started to break down. They were very beginning stage 1 sores, weren't they? Patrick's current carers, so my brother and my sister, they did not make us aware of the pressure sores, so you were doing physio.
Yes, without knowing that he had pressure sores.
Yep, and I was giving him a massage as well, so we didn't know, so we irritated them for the day. As soon as I changed them for bed, we saw them. We notified my sister and my brother. Now,
we bought bandages and we left them instructions on how to deal with them. They should have been over in a couple of days, but because they hadn't started to break down, no pus or anything like that.
They're not cheap either. The hydrocolloid and the silicone patches went about $80.
It's a lot out of my pension, and going to visit Patrick takes half of it.
They just refused to use them. So
yeah, they refused to use them. They took Patrick to the doctor, and he must have thought it was eczema because he prescribed some eczema.
We don't know if Patrick attended the clinic again.
Yeah,
we don't know if it was a phone appointment. We don't know. So I reported that doctor as well. But he prescribed eczema cream. Now, we were on the phone to the OPA and to VCAT trying to get this sorted because Patrick could easily lose a limb.
Because the last time we saw him was 2 weeks later when we had him for 2 days. Okay, they started to break down. One of them was quite large.
One of them had all the pus underneath.
Had pus underneath. My son doesn't know that there's no, you don't lose the skin on the top. It sort of swells up, and that's called proud flesh.
Which is what Patrick had.
Which is what Patrick had and had to be dealt with. So Alice arranged for...
I rang the Eastern Stoma Clinic. They were actually on holiday because this happened over Christmas and New Year's. They got back to me the day that they got back, so it was probably about a week and a half later they got back to me. They confirmed that they could visit the property, that they could treat Patrick, and that they could put in preventative measures and a treatment plan for when those preventative measures failed. My brother completely refused, the OPA has refused to assist, and suddenly, conveniently, our visitation has been cancelled.
Not legally, but just by my daughter, and the OPA, of course, will do nothing about it because, the
OPA sent them an
we
email.
photograph and film and all that sort of thing, so we have plenty of evidence of what's going on out there. It's not our word, but terrible not to know how.
Remember, according to Patrick's respiratory specialist, he is in the best health that he has ever seen him.
They eventuated. I mean,
Yeah.
Patrick.
No, it's pretty clear what happened. Patrick has pressure boots that he's supposed to wear at night. He wouldn't have been wearing them because he hasn't had pressure sores for so many years.
He's everywhere he goes, he's got a pressure mattress.
Well, he's got two just in case because they're fairly unreliable. But what would have happened is because he's not wearing his boots, which is not negligent.
No, I often didn't put him in his boots because I'm moving him around at night. But he's in a hospital bed and he stays in exactly the same position all night. You can't just, Patrick's gone to bed, we'll just shuffle off now and leave him.
He needs to be checked all the time.
He needs to be checked all the time. You need to move him around a bit. He'll often wake you up and say, legs are really stiff, do something about it. Okay,
I've had a nightmare.
Yeah, legs have to be massaged. I've had a nightmare. He can dislodge his oxygen tube.
Look, where he is, there is a baby monitor which will alert his sister.
But obviously nobody came over this period.
I think what's happened is he's moved his legs, either he's coughed or something, then his lower limbs, his ankles have been crossed, and then it's just first stage. Then you should be putting on the pressure boots, shouldn't even need to go to the doctor, and then it should clear up within a few days. No, not so. We still have no confirmation of whether Patrick even has his legs anymore.
Yeah, well, Patrick's not prone to pressure sores. He had them once when he was in his early teens. We took him straight into the stoma clinic, and we bought a upsy-downsy mattress, a pressure mattress, so that changes his position all the time, so that he never had pressure sores after that. Oh, we also had a foam ring for his head. His ear was a problem. And we bought the pressure boots. So
really, to nail home though, Patrick, we haven't even been able to speak to Patrick.
No.
So Patrick will have been getting told, because this is we have proof of this is what Patrick gets told, is that he gets told Mum doesn't want to see him, I don't want to see him, or we can't be bothered, and that's why he's so angry when we go and actually visit. He yells at us for the whole afternoon. We have to explain to him that he's getting lied to. But we can't even have a phone call to explain, hey, we want to see you, but we can't.
He can't understand why he can't go home with his mother.
Yeah, in his head, we don't want him.
Yeah.
Yeah? Okay, well, I think we'll call that a day for this one. This one's been a fairly heavy video.
We were hoping not to do this. My husband had a friend who was a journalist, and when Patrick was first taken, she offered to... Assist.
But Mum being, she didn't take my advice, did you?
No, I never do. And, we should have gone ahead then. But I thought the children would be sick of caring for him. They've all said they don't want to care for him.
So the hearing where Patrick lost consciousness, we do have one little bit of extra information for you. So over to Mum.
Yes, it was my son's plea of how much he's suffering. Apparently they've all had to get jobs, he claimed. So nearly 50.
My brother's worked once and my sister has worked once.
He worked for three months as a
barman, as a mini barman.
Mini barman, yes.
So poor little Diddums have to get jobs. Okay. On that note, goodbye from me,
And me?
Rupert, Bertram, and Biggles.
They've been very well
They
behaved this
have
time.
been very good.
Yes.
Because they're tired, because their brother's sick.
They're awful dogs.
I love them.
They're Patrick's dogs, actually, not Alice's.
Okay, well, thank you very much, and we'll see you next time.